Welcome back. Tonight we're having a discussion on the preparation when it comes to ensuring that nurses, as they face this particular pandemic, whether the government is doing enough to support them and whether the health facilities themselves are quite equipped to help in combating this particular disease. We are having Alex Mudhui from Kelly Organization, of course, to tell us more, given that they did a survey finding on how the nurses are protected at this particular point. Welcome, Alex.
Thank you, Irene.
Okay, tell us, there have been different parameters that have been looked into to see whether nurses are prepared at this particular point. The first one being the issue of ensuring that they have the protective gear. There's been that concern that some of the nurses in several hospitals do not have the protective gear in some counties, not only in Nairobi, but different counties across the country. And there's been an issue that the cases are continuing to increase. And therefore, it is the importance of the government or the county government to ensure that the nurses have the protective gear. Can you tell us what you've been able to find in terms of ensuring that this is taken into place?
The healthcare workforce are at higher risk. They are 21 to 32 times at higher risk compared to just the general population. So it's key that we ensure they are well protected. So in that regard, when we're having this conversation, we looked at different parameters. One of them was the PPEs, as rightly put, the personal protective equipment. So according to our discussion with the nurses, we found that more than 93% are stating they do not have these PPEs. And specifically, we also asked the specific PPEs that are not available. 93% stated they don't have the eye protection gear, they don't have the gowns, they don't have the face shield. So from these findings, this is a worrying trend, given that we know clearly the government has also provided the resources to be able to procure these items, yet on the ground, seems the items are not yet there. So it's a key thing, giving out doubt or being cognizant that the nurses are almost so the healthcare workers at higher risk to contract this disease compared to the general population, and then they can be an epicenter of transmission. So that is one of the findings that we got. So the other part you are asking in regards to testing, again, testing of the healthcare workforce, specifically the nurses. Our conversation with the healthcare workforce, the nurses particularly, it shows us that 95% have still not been tested. Right. So again, this is a worrying statistic because if you talk about 95% of the healthcare workforce who don't know their COVID-19 status, it's a worrying trend because, like we said, they need to know their status because they are the ones who are providing they are the frontline workers in this particular case. So they need to know their status so that they protect their other healthcare fraternity, as well as protecting patients and also even protecting their loved ones at home. So it's prudent that they be tested, yet they have not been tested. And we know even sometimes back, sometimes in mid-April, there was a directive by the CAS in terms of testing, mass testing, most in the high-risk regions and also the high-risk population. And for high-risk population here, healthcare workers fall in that category. Yet this has not happened as of date. So again, we are urging more measures to be put in place so that we have the healthcare workforce being tested.
According to your survey, the survey that you did, what are some of the counties that have been affected or have not adhered to ensuring that the nurses are protected? During your survey, could you point out some of the region or some of the counties specifically that have been affected or have not adhered to this particular directive by the Ministry of Health?
So we were able to have a conversation with nurses from 33 counties, and majority of them are from Nairobi. So actually the target counties, the hotspot counties, Nairobi, Mombasa, Kilifi, Kwale, were the major ones. Though we talked to 33 nurses from 33 counties. So I can tell you this one cuts across because the prevalence of nurses being not being tested, if you talk about 95% of the nurses that we're able to talk to, that's already a very big chunk. of the numbers of nurses that have not been tested. So this one cuts across the particular counties that we're able to have a conversation with the nurses. So I can say all the counties need to put measures, because from the findings, it cuts across. There's no specific county that we can say it's doing better than the others, but it should be a continuous process that the nurses should be tested towards for them to know the COVID-19 status. I wanted also to highlight another issue about training. The government has provided, we have MOH guidelines in regards to COVID-19 management. The government has, if you go to their portal under the COVID-19 and you look at the resources, we have more than 50 guidelines that talks about management of other management of COVID-19 and also other approaches, including the psychosocial and mental support for both patients, for both healthcare workers. So if you look at the testing, if you look at the training, we found that almost 54% of the healthcare workforce, particularly the nurses, have not yet been trained. So why is this a worrying concern, Irene? Is because if the healthcare workforce have not been trained, how can they be able to deliver proper healthcare in response to COVID-19 while they do not have the knowledge and the skill? So this is a key thing that we believe. I know the government has provided a procedure or a manual on how this training should be done, but I think the national government, we had a conversation also with a representative from the national government today, MOH, and they said the guidelines have been provided, but also the duty don't stop, the buck doesn't stop with only the national government, but it boils down also to the county government, because the implementation is where it stops with the county government. So I think it's upon the county government to take this initiative and ensure, with the proper guidance and the MOH guidelines that have been provided, all healthcare workforce, especially that are in close contact with the patient, a COVID-19 positive, someone who has positive COVID-19, they should be trained. And more so, all the healthcare workforce within the facility, they should be sensitized on COVID-19 management.
All right. There has been a concern that has been raised by nurses and the union of medical officers, saying that the capacity in hospitals cannot be able to handle the COVID-19 patients should the infections continue to rise. I don't know, during your survey finding, if this is one of the issues that was highlighted by nurses, of course, raising their concerns on what is going on in the country? Again,
yes, this was part of the conversation that we had with the nurses. And slightly put, we found that more than 83% of the nurses stated they are not in a position to be able to handle the current inflow of clients, and more so, they are not well prepared to handle COVID-19 cases. This is because of the several reasons that I've stated. One of them is because they have not been trained. 54% have not been trained. The second thing is that they do not have enough staff who can be able to handle or who can be able to provide this particular healthcare service. So more than 60% of the nurses say they do not have enough staff for them to be able to provide services. So, and this one is against, again, we know that there was almost 1 billion that was given out. That was there was reallocation of the budget from the UHC kitty to provide healthcare to ensure that the healthcare workforce has been trained on management of COVID-19 cases. But yet on the ground, we have the healthcare workforce has still not been trained. So again, they say they are not well prepared. And on top of that, you can clearly see the findings. The PPEs are not available. So this is a key issue, that the PPEs are not available on the ground. So they are more at risk because they don't have the equipment, they don't have the knowledge and skill, and furthermore, they are less staff who can be able to provide this service. So I think that's where, in terms of level of preparedness, those are the key things that came out from our engagement with the nurses.
All right. The nurses have been giving themselves out, something we call self-sacrifice. Some have been working for longer hours, and there's been a concern about their mental welfare, whether their mental health is right at this particular point. And there has been, the Ministry of Health has said that they are being given a debriefing. I don't know if that is just what is being said. Is that what is happening on ground?
Thank you, Erin, for that. Yeah, for sure. We also were able to gather this information from the nurses, and what was coming out is that 95% of the nurses say they require psychosocial support. Again, I mentioned, and I'll still mention, that the government has provided guidelines and policies that pertain psychosocial support and mental health, both for the healthcare workforce, for the general population, and also they have desegregated further to different populations. So for the healthcare workforce, one of the key strategies that have been provided in the guidelines is that they need to be given enough time to rest after work and also to have debrief because they are going through a lot working with this or taking care of this particular COVID-19, people living with COVID-19. So it's something that is unusual to them. So they need all that support, and they stated that 95% of them stated that they need that psychosocial support. And some of the reasons that they stated why they need this support is because of the hardship. They mentioned about the hardship. They feel it's it's being strenuous in terms of the working hours. Yeah. The other thing that was coming out is stigmatization, because people now see these are the healthcare workforce, they're working in health facilities, they're closely interacting with people living with COVID-19. So at the end of the day, they might expose the general population. So there's a lot of stigmatization, which we need to preach against it because it's affecting the healthcare workforce. And from what we got from this engagement is that they have not been given the support or the psychosocial support that they require. So again, this is a worrying trend, and we need to ensure that the healthcare workforce get the right support that they require.
Of course, the Ministry of Health has said that what needs to be done is the implementation. Have they given the support that is required for that?
From our discussion or from our engagement with the nurses is that they have not felt this support yet. Yes, the government is doing to some extent is trying to provide support, but the support has not been felt or has not reached to the ground. Talking about even the motivation and incentives, I know SRC have provided some guidelines on the allowances that has been shared in the public domain, which is a good gesture from the government that they'll be given these allowances for the next 3 months. But there's more that can be done, and one of the key things that we are saying is that what was coming out is that the nurses feel their life is at risk. 95% they say they feel they are at risk in terms of contracting this particular disease, and they need more than even that, the support in terms of the financial support. What they need also most is the life insurance cover. And from our findings, only 8%, less than 8%, have life insurance cover because their life is at risk. So they need what we call the Work Injury Benefit Act, which covers them in terms of their security and in case of untimely death, because that is caused by exposure or unsafe working environment, that they can be able to be compensated for this.
What are some of the fears that the nurses have raised apart from the support when it comes to being given the protective gear, being given an opportunity to debrief? What are some of the fears that they have raised apart from that?
In terms of other fears that they've been able to raise is, like I mentioned, they actually, their main worry actually is the safe working environment. They feel at the moment their position and also the engagement with or providing services to people with COVID-19, they're putting their life at risk like no one else. They are the front line in terms of this response. yet they don't have the right PPEs. They don't have sufficient PPEs. Actually, what was coming out is that more than 70%, they have to reuse the same PPEs. And we have the single-use PPEs that it means they have to be disposed immediately after they're being used. But to some extent, they find themselves that these have to be used. They have to reuse this, because they don't have enough PPEs and they have to provide healthcare service. So that's a major worry for them. The other part was, I mentioned about the life insurance cover. They actually need this because they feel they are already at this and they are responding, but they risk a chance. They have a risk that they can be able to contract easily this disease, and this one could lead even to, God forbid, untimely death. But yet they know they have their loved ones, they have families to take care of, yet they don't have the life insurance cover. So this is also a big issue for them. And they also say they need a lot of training, because without the right capacity, they cannot be able to respond better. So they need the right capacity in terms of even putting on the PPEs, putting off and disposing what we call the donning and doffing of the PPEs, and even the waste management environment. That's a thumbs up to the government. They have waste management materials or equipment, but the problem is the disinfection or the disposing of those materials. Majority of the facilities, they do not regularly clean, or they do not regularly disinfect those areas. So this is an area that could lead to infection or reinfection even to other healthcare workforce. Just putting in mind, the health facility doesn't have only nurses, it has cleaners, it has the front office, it has the lab people, it has other healthcare workforce, physicians, and so forth and so forth, who are working within the health facility. So if the waste within the facility is not well managed, it's not well disinfected, then you risk the entire health workers fraternity being exposed to this particular virus, and this one could be the epicenter of the spread of this particular virus.
Okay, thank you, Alex. We don't want these findings to just remain on the shelf or to remain a mere talk. To ensure that the missing gaps are identified and what needs to be done is done, as a non-governmental organization, have you tried to reach out to the national government and the county governments to ensure that they look into these missing gaps, so that we can be able to ensure that what the nurses are saying and their fears are adhered to?
What I can say, Irene, yes, we have been able to, actually, in all these, when we are talking about this particular information that we got, is that we included in our conversation, or when we're disseminating this information, we invited, and today we had a very senior person from MOH, the acting director, assistant director of clinical medicine, or clinical medical services. The assistant director was there, and he was able to listen to all the issues that were coming out. The good thing also, the union, the nurses union, the president of the National Nurses Association of Kenya was also present, and he affirmed to this particular information that we were able to share. And the government was there to listen, and they were able to address some of these issues and stated what the government is still putting in place in order to address all these issues. So I think the conversation has started. We are not saying that, and it came even out of this conversation, they say that the government is not perfect, but they are trying. But our work is to ensure that we hold also the government accountable to their mandate, and that's why we are also sharing this information. And from our end, because we are a network, we are a network of NGOs and also a consortium of who are working to ensure the health rights are adhered to toward the right-based approaches. So we've worked with, we are working with the unions, we are working together with other NGOs, and we are working, this information, we are planning also to share the findings through the various legislative frameworks, from looking at the National Assembly and also the Senate. We are hoping this will also reach, because they are the policy makers. They are the policy, yes, they are the policy makers and also the policy implementers. So we want to ensure that all this has been adhered to, and at the end of the day, we are going to have a right-based response to COVID-19.
Right.
So all this is not just documentation,
Yeah.
but we've started the conversation, we've shared the finding, and we believe it will be a continuous process. We'll keep on advocating for the rights for all, especially for mostly the healthcare workforce and also for the general citizens.
All right. Thank you so much, Alex Mudhui, for your time. And of course, giving us the insight on what you've been able to find in terms of filling the gaps when it comes to looking into the issues of the nurses.
We hope, again, just to mention, tomorrow we are also disseminating the findings for the medical KMPDU, the medical practitioners, pharmacists, and dentist union. So we have the findings and we invite you all for that dissemination.
There has been Alex Mudhui from Kelian Organization, of course, giving us the findings on what has been happening in terms of ensuring that the issues of nurses while they combat COVID-19 has been adhered to. Of course, him saying more than 90% of nurses have not been given the protective gear, which is the first tool when it comes to fighting this particular virus. We are taking a short break, but once we return, we'll be returning with more from the international sector. Stay tuned.